Introduction. Bipolar disorder is one of the most contentious and perplexing topics in mental health. Bipolar disorder affects millions of people worldwide, providing challenges not just for those who experience the condition, but also for their loved ones. This book offers a thorough introduction to bipolar disorder, examining the disease from a clinical and psychological standpoint. I am aware that each person's experience with bipolar disorder is unique. My aim is to inspire you to choose your own route and use strategies that works better for you. By relying on the most recent academic findings, ideas from professionals, and the personal experiences of those who have overcome this condition, this book will shed light on the complexities of bipolar in a manner that is understandable. Whether you're a person living with bipolar, a caretaker, or simply someone interested in learning more about the condition, you'll come to the right place. This book is all you need to learn everything you need to know about managing bipolar. Enjoy. Chapter 1. A brief introduction to bipolar disorder. Bipolar disorder is a mental illness characterized by manic episodes and depressed periods that it is grouped into three main types. Bipolar I. Bipolar I is typified by manic episodes, which are marked by intense elation and increased activity, and depressed episodes, which are marked by profound depression and loss of interest in various activities. It is characterized by manic phases that are often followed by depressed episodes. A person's self-esteem may become overinflated, their need for sleep may decrease, they may talk excessively, their thoughts may rush, and they may engage in unsafe actions when experiencing a manic episode. Although thrilling, these manic moments may lead individuals to make rash decisions which can put a strain on their relationships. Depressive episodes are characterized by feelings of sadness, hopelessness, and a lack of interest in activities that were formerly pleasant. Possible symptoms include changes in appetite, sleep disturbances, difficulty concentrating, and even suicidal thoughts. Bipolar II. Bipolar II is less severe than bipolar I since it is characterized by hypomanic episodes rather than full-blown manic episodes. Some of the more noticeable symptoms of bipolar II includes low mood fluctuations that are quite similar to those who are suffering from severe depression. The signs of a depressed episode include sadness, hopelessness, loss of interest in or pleasure from once enjoyable activities, changed eating and sleeping patterns, exhaustion, trouble concentrating, and even suicidal thoughts. Manic episodes, which define bipolar I, are more severe than hypomanic episodes. Elation or irritability, increased activity or energy, decreased need for sleep, quick thinking, inflated feeling of self-worth, risky behaviors, and improved sociability are some indications of hypomania. Cyclothymic disorder. People with cyclothymic disorder oscillate between hypomanic episodes and depressive episodes on a regular basis. It is regarded as a subtype of the bipolar spectrum, alongside bipolar I disorder and bipolar II. Cyclothymic disorder patients often have milder mood swings than those seen in bipolar I or II. People with cyclothymia have hypomanic and depressive episodes that are less intense and last less time. Hypomanic episodes are characterized by high or irritable mood, increased energy, quick thinking, decreased need for sleep, inflated self-esteem, and increased goal-directed behaviors. Even while these episodes aren't as severe as full-blown manic episodes, they may nonetheless disrupt daily living and lead to impulsive or hazardous behavior. Many of the depressive symptoms of cyclothymic disorder are similar to those of major depressive disorder, including sadness, hopelessness, tiredness, changes in appetite, sleep problems, and a difficulty to concentrate. However, compared to severe depressive episodes, the intensity and duration of these symptoms are often lower. Cyclothymic disorder may be diagnosed by the presence of mood swings that last at least 2 years, or 1 year in children and adolescents, without a symptom-free period longer than 2 months. The symptoms must have a considerable negative influence on a person's ability to perform in their social, occupational, or other important domains. Risk factors and potential causes of bipolar. 1. Gene. Despite the fact that the precise causes of bipolar are still unclear, research has shown that genetics has a significant impact on how the disease develops. The fact that bipolar disorder often runs in families suggests that it may have a genetic component. People with a first-degree family who also has bipolar illness, such as a parent or sibling, are more likely to develop the condition themselves. According to many studies, The heritability of bipolar disorder is estimated to be between 60 and 80%. Bipolar has been linked to several genes that have been identified as possible risk factors. Ion channels, circadian rhythms, and neurotransmitter systems are just a few of the functions of the brain that these genes assist in controlling. It has been suggested that the BDNF, CACNA1C, DAOA, and DISC1 genes contribute to the onset of bipolar. Genome-wide association studies, GWAS, have shown a number of genetic variants to be associated with bipolar disorder. When several variants interact with one another, a person's polygenic risk for the disease may rise. Not just hereditary factors, but also the interactions between those factors and the environment raise the likelihood of developing bipolar disorder. Environmental factors including exposure to stressful life events, substance addiction, and anomalies in sleep-wake cycles may also have an impact on those who are prone to bipolar. 2. Imbalances of neurochemicals. Research suggests that neurochemical imbalances in the brain may play a role in the development of bipolar. There are a lot of chemical abnormalities in the brain that are associated with bipolar. Dopamine is a neurotransmitter that functions in the reward and pleasure circuits of the brain and whose levels may fall out of balance. During manic episodes, dopamine levels may increase, heightening feelings of elation and excitement. Contrarily, low levels of dopamine may contribute to depressive symptoms by making people feel down and lacking in motivation. Serotonin is another neurotransmitter that affects appetite, sleep, and mood. According to studies, people with bipolar disorder may have abnormal serotonin levels, particularly when they are depressed. Mania has been associated with high levels of serotonin, whilst depression has been associated with low levels of this chemical. Norepinephrine, a neurotransmitter involved in stress, is also usually dysregulated in people with bipolar. Mania and depression in bipolar disorder have been connected to noradrenaline imbalances. Mania is typified by heightened noradrenaline levels, which are also associated with enhanced noradrenergic states of alertness, energy, and impulsivity. Glutamate and gamma-aminobutyric acid, GABA, imbalance. These two neurotransmitters are critical for the regulation of the brain's excitatory and inhibitory signals, respectively. Bipolar disorder has been associated with improper regulation of these neurotransmitters. GABA imbalances may contribute to symptoms like anxiety and irritability, while changed glutamate levels have been associated with cognitive impairments and mood dysregulation. Although these neurochemical anomalies are seen in bipolar patients, they do not provide a complete picture of the disorder. Neurological, environmental, and genetic factors are all involved in the onset of bipolar disorder. Bipolar is often treated with a combination of medication, therapy, and behavioral adjustments to help with symptoms. 3. Environmental triggers. Studies have revealed that environmental variables may contribute to the development of bipolar in individuals who are already predisposed to it. People who are predisposed to bipolar may suffer manic episodes as a result of major life changes like marital problems, professional stress, or traumatic experiences. Some people who have bipolar claim that sleep problems, such as insomnia or a disruption in their regular sleep-wake cycles, play a role in the onset of manic or depressive episodes. Drug and alcohol abuse may both start and exacerbate manic and depressive episodes. Addiction to substances may disrupt emotional stability and lessen the impact of psychiatric treatments. Antidepressants, corticosteroids, and illicit drugs including stimulants and hallucinogens have all been related to the emergence of mania and depression in those who are already vulnerable to bipolar. Some bipolar patients exhibit seasonal patterns, where episodes are more frequent at certain periods of the year. For instance, some people experience a wintertime increase in their vulnerability to depression, seasonal affective disorder. It's important to keep in mind that although these variables may contribute to the onset of bipolar, they are not the main culprits. Chapter 2. Symptoms and diagnostic criteria for bipolar. Manic episodes are a frequent symptom of bipolar. People with bipolar disorder may experience extreme swings in their mood, energy, and activity levels. All types of bipolar have manic periods. Although the strength and duration of the episodes differ, one of the most prevalent indications of a manic episode is 1. High spirits. Feeling energized all the time and having problems relaxing at night are signs of having high spirits, IT is challenging to concentrate for extremely long periods of time when brain processes are rapid and unregulated. Increased goal-directed activity is indicated by excessive goal-directed conduct, such as multitasking or binge buying, acting impulsively, or taking unwarranted risks, such as while operating a motor vehicle or playing poker. A manic episode may make it very difficult for someone to carry out daily tasks. The duration and severity of manic episodes might vary from person to person. A bipolar or manic episode often lasts for at least a week and may need hospitalization. Bipolar 2 is characterized by less severe hypomanic episodes that can last for at least 4 days. 2. Depressive episodes. Major depressive episodes are a hallmark of bipolar. Individuals with bipolar disorder suffer manic and depressed episodes at different frequencies and intensities. Bipolar disorder depressive episodes are distinguished by prolonged feelings of despair and hopelessness, as well as a loss of interest or enjoyment in once pleasurable activities. During depressive periods, people with bipolar may also experience other symptoms such as lack of strength, changes in weight, either sudden weight loss or gain, or body mass index, issues in either staying asleep or falling asleep, difficulty concentrating or deciding on a plan of action, and negative feelings, such as excessive guilt or self-loathing. Because they are interspersed with manic or hypomanic episodes, bipolar disorder's depressive episodes differ from major depressive disorder's depressive periods. Depending on the individual, depressive episodes may range in duration and severity and can endure for weeks or months. 3. Hypomanic episodes. People with bipolar disorder oscillate between depressive periods and hypomanic phases. Hypomania is seen as less severe than full-blown mania, although having certain characteristics, such as elevated mood and increased activity, with manic episodes. During hypomanic episodes, some persons describe symptoms such as enhanced mental state, having a lot of energy, being agitated, and having a lot of stamina, that a difficulty to concentrate because your thoughts are constantly bouncing around, speaking quickly, and having a strong desire to communicate with others. And then grandiosity. Increased goal-directed activity, such as juggling many projects at once or engaging in excessive behavior like taking on excessive amounts of work, indulging on shopping binges, or making rash judgments that risk-taking conduct includes behaviors with a high potential for negative effects, such as compulsive gambling, reckless driving, or risky sexual activity. The distinction between hypomanic and manic episodes must be made clear at all times. Manic episodes, in contrast to hypomania, are more severe and may be accompanied by psychotic symptoms such as hallucinations and delusions. Most of the time, hypomanic episodes don't need hospitalization and don't impair a person's capacity to function. 4. Dysphoric mania. A person is said to be suffering from dysphoric mania when manic and depressed symptoms appear at the same time or quickly one after the other. The low mood, low energy, and hopelessness of depression are apparent when contrasted with the high mood, increased vigor, and impulsivity of manic episodes. A person having a mixed episode may exhibit symptoms of both mania and depression, making it challenging to manage their mental health. Dysphoric mania is marked by a wide range of symptoms, including agitation, often known as irritability, is characterized by intense impatience and lack of attention. Increased vitality, mental activity, and unpredictability in conduct as a result of impulsivity is a sign of agitation. Having difficulty falling or staying asleep, or requiring less sleep, yet still feeling more rested than normal are all symptoms. In more serious cases, there may be suicidal or self-harm thoughts. They also show poor judgment, and there may also be a swing in appetite. Diagnosis of bipolar disorder. The DSM-5 Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is where bipolar disorder diagnostic criteria are most often taken from. The diagnosis of bipolar I disorder requires at least one manic or mixed episode. An elevated, expanded, or agitated mood that lasts for a long period and is accompanied by increased energy or activity is what is known as a manic episode. A substantial depressed episode may come before or after the manic period. If a person has had at least one major depressive episode and one hypomanic episode, they are considered to have bipolar 2 disorder. Hypomanic episodes are less disruptive to everyday life and work than manic ones. The milder form of bipolar disorder, known as cyclothymic disorder, is characterized by recurrent periods of hypomanic symptoms and depressive symptoms that do not meet the criteria for a major depressive episode. This condition can last for more than 2 months in adults, while it lasts at least 2 years in children and teenagers. Because its symptoms often overlap with those of other mental health issues, most notably severe depression and anxiety. Given the complexity of bipolar disorder, a thorough diagnosis requires a multidisciplinary approach that includes a thorough clinical interview, information from friends and family, a mood chart, and rating scales. Without a proper diagnosis, bipolar cannot be treated properly. A thorough diagnostic approach is needed since bipolar disease symptoms may manifest in a broad variety of ways. A comprehensive clinical interview serves as the foundation for the clinician's evaluation of the patient's symptoms. The use of standardized assessment tools and rating scales may help the diagnosing process even further. The Hamilton Depression Rating Scale, HDRS, and the Beck Depression Inventory, BDI, may be used to assess depressive symptoms, whereas the Mood Disorder Questionnaire, MDQ, and the Young Mania Rating Scale, YMRS, can be used to assess manic symptoms. To increase the accuracy of diagnoses, clinical judgment may be augmented by these various diagnostic tests. The DSM-5's bipolar disorder diagnostic criteria provide a consistent framework for identifying and categorizing this mental disease. However, there are still challenges in accurately diagnosing bipolar disorder. A thorough clinical examination, supporting paperwork, a mood chart, and proper assessment tools are just a few of the aspects that must be taken into consideration to provide an accurate diagnosis for bipolar. Together with the use of emerging biomarkers and neuroimaging techniques, mental health professionals may make a more precise and personalized diagnosis of bipolar disease. Also, early, accurate diagnosis and subsequent use of efficient treatment modalities may significantly improve the quality of life for persons who live with bipolar. Chapter 3. Warning Indicators for Bipolar. Recognizing the initial indicators of bipolar is crucial for intervention and successful treatment. Bipolar patients may experience their symptoms in a variety of ways, with variable frequency and degrees of intensity. Because early symptoms may not be as visible or severe as later ones, it might be challenging to make an early diagnosis. However, there are a few warning signs that may point to bipolar in individuals. One of the key signs of bipolar disorder is extreme mood swings. Manic individuals may be excessively ecstatic, irate, or happy. On the other side, they could experience continuous depression, feelings of worthlessness, and a lack of interest in activities while they're going through a depressive episode. Mood and energy fluctuations are typical signs of bipolar disorder. In spite of an increase in activity levels and agitation, manic episodes are distinguished by a decreased desire for sleep. Contrarily, depression may make a person feel constantly worn out, depleted of energy, and in need of more sleep. Bipolar also brings about impaired judgment or impulsivity. Manic individuals could behave rashly and impulsively without considering the consequences of their choices. These hasty judgments could have a significant impact on their personal and professional lives. During manic periods, a lot of persons with bipolar disorder experience increased activity and racing thoughts. They could attempt to multitask or take on many activities at once, which might cause their thinking to seem disorganized. They could also have a stronger sense of purpose, put forth more effort at work, or exercise more often. Changes in hunger and weight occur often in people with bipolar. People who have manic episodes seldom lose weight because they are less hungry. On the other side, if someone is going through a depressive episode, they could overeat and gain weight. Bipolar often manifests as sleep issues. Some individuals who have manic episodes claim to feel rested after just a few hours of sleep. They could have insomnia, however, when they're feeling down and have problems falling or staying asleep. Bipolar disorder has been associated with a lack of social drive and an increase in self-reliance. During depressive periods, some individuals have emotions of hopelessness or depression, which may make it challenging for them to engage in or maintain social relationships. Recognizing these early signs of bipolar disease is crucial since early treatment may significantly improve long-term outcomes. If you or someone you know is displaying these signs, get urgent help from a mental health professional. Due to the complexity of bipolar disorder, it's crucial to keep in mind that a self-diagnosis is not recommended. Why is the right diagnosis important? A proper diagnosis is necessary for effective treatment, so that physicians may recommend the appropriate medicine or therapy. Bipolar disorder treatment is often continuous and may need to be modified depending on the patient's needs. A detailed diagnosis may help tailor treatment choices, such as medication, psychotherapy, and behavioral changes, to the patient's unique needs. The quality of life for persons who have bipolar may be significantly improved by effective treatment and management. The ability to regulate symptoms, minimize the frequency and severity of mood swings, and live a more normal and productive life is aided by accurate diagnosis. Suicide ideation is frequent in people with bipolar, particularly during manic stages. Utilizing therapeutic techniques, including talk therapy, medication, and peer support groups, may reduce the risk of suicide. Bipolar is often misunderstood or confused with other mental health conditions like depression or ADHD. Without a proper diagnosis, treatment may exacerbate symptoms or fall short of curing the underlying cause. A correct diagnosis enables patients to avoid taking medications they don't need and ensures they get the optimal treatment. Improved patient education and self-awareness may result from a correct bipolar diagnosis. It's an opportunity to learn more about the illness, its symptoms, its causes, and how to treat it. People may then actively participate in their own therapy by being aware of warning signs and seeking expert help when required. Correct bipolar diagnosis increases social support and acceptance. An accurate diagnosis may validate an individual's experiences, enhance communication with family, friends, and peers, and encourage the development of social support networks. An accurate diagnosis opens the door for customized treatment programs that are created to address the particular symptoms and health issues of each patient. Specialized treatment may be required for several bipolar disorders, including manic depressive mania and hypomanic depression. A prompt and correct diagnosis of bipolar may lead to better outcomes with early care. Early identification and treatment of bipolar may lead to a better prognosis, fewer comorbidities, and fewer episodes. As a result, bipolar disorder may be handled proactively and the harmful consequences of delayed. Accurate diagnosis is necessary to identify and treat the co-occurring disorders that often accompany bipolar. Co-occurring illnesses include anxiety disorders, substance use disorders, and sleep problems. Effective therapy and improved health outcomes depend on the identification and treatment of these co-occurring illnesses. The development of clinical trials and other types of research on bipolar disease is aided by accurate diagnosis. This approach allows for more detailed research of the prevalence, progression, and impact of the illness and its treatments. This information may be used by researchers and medical professionals to develop diagnostic standards, identify new therapeutic methods, and further their knowledge of bipolar disorder. An accurate diagnosis helps in the long-term stabilization and self-management of bipolar disease. Always keep in mind that if you or someone you know is exhibiting signs of bipolar disorder, you must visit a doctor. Early diagnosis is very important. Effects of bipolar on daily activities. Bipolar disorder patients who have manic episodes have increased energy, fast speech, and quick brain processes, all of which may make it difficult to communicate effectively, which might result in misunderstandings and pressure on relationships. Dramatic mood fluctuations associated with bipolar disease can have a negative impact on relationships. Rapid shifts from exhilaration and high energy, mania, to grief, rage, and withdrawal, depression, may be challenging for spouses and loved ones to adapt to. Due to the unpredictable nature and severity of bipolar episodes, both the individual with bipolar disorder and those who care about them may feel emotional stress. Relationships may suffer from the burden of providing care for a person who has bipolar disorder. The normal juggling act of who does what and when might get distorted by bipolar. Bipolar patients may impose additional stress on their loved ones by being overburdened by the responsibilities of daily life during depressive episodes. Bipolar disorder may have a significant influence on a person's capacity to keep down a job. This might make it difficult for them to maintain consistent employment. Due to the cyclical nature of bipolar disease, Reckless spending during manic episodes is frequent and may result in financial problems. People with bipolar often have sleep issues, particularly when manic. Unreliable sleep patterns, insomnia, or a diminished need for sleep may have a negative impact on daily functioning and well-being. People with bipolar disorder may isolate themselves from their social groups as a result of the unpredictable nature of the disease and the stigma associated with mental illness. People with bipolar disease can effectively manage their symptoms and have fulfilling lives with the help of an early diagnosis, effective treatment, and continued support. Chapter 4. Concurrent disorders. Even though bipolar disorder presents major difficulties on its own, it often co-occurs with other illnesses that make diagnosis and treatment considerably more challenging. Understanding the co-occurring illnesses associated to bipolar disorder is crucial for the proper treatment of the condition and improvement of overall well-being. We'll talk about some of the most prevalent comorbidities with bipolar disorder and their impact. Anxiety disorders. A research found that almost half of all bipolar patients also have anxiety disorders. Bipolar may worsen symptoms for people who already have anxiety disorders such as GAD, SAD, and panic disorder. Drug use disorders. Studies show that bipolar and drug use disorders often co-occur. Addiction to drugs or alcohol may be utilized by bipolar patients as a coping technique to ease their crippling symptoms. Contrarily, substance usage may exacerbate mood swings, lessen the effectiveness of drugs, and increase the chance of impulsive conduct. When bipolar disorder and substance usage coexist, it's critical to provide treatment that addresses both issues simultaneously. Although the relationship between ADHD and bipolar disorder is complex and poorly understood, the two often coexist. People with these disorders may have difficulties with attention, impulse control, and executive functioning. The presence of ADHD symptoms may make a bipolar diagnosis and treatment planning even more difficult. One must adopt a comprehensive approach that considers the unique challenges of each sickness in order to properly treat both conditions. Eating disorders including anorexia, bulimia, and binge eating disorder often co-occur with bipolar. Common genetic, neurological, and environmental variables are thought to have a role in the relationship between these illnesses. Bipolar may exacerbate mood fluctuations and the risk of self-harm in those who already have eating disorders. The simultaneous treatment of eating disorders and mental health conditions necessitates collaboration between specialists in the two disciplines. Problem sleeping. Sleep disturbances in patients with bipolar disease may have a significant negative influence on daily functioning and mood regulation. Many patients who suffer from bipolar disorder also have sleep issues, such as sleep apnea and insomnia. Manic or depressed episodes might become more frequent and intense if you don't get enough sleep. Taking care of sleep issues is essential for stabilizing people with bipolar disorder and managing their condition. It's important to keep in mind that not every person with bipolar disorder will have the same combination of comorbidities. That's why it's important to customize therapy to the individual's needs. Co-occurring disorders must be recognized and treated as part of the bipolar disorder treatment plan, since they may have an impact on the course and prognosis of the condition. It is important to address co-occurring disorders with people who have been diagnosed with bipolar disorder in their families, including common symptoms, risk factors, and treatment options. People are better able to make knowledgeable treatment decisions, develop healthy coping strategies, and ask for assistance when they need it if they are better informed. Support networks, which may include family, friends, and support groups, may be of tremendous help to those with bipolar. The comfort and acceptance that friends and family may provide is essential to maintaining stability and promoting recuperation. Chapter 5. Treatment for bipolar. Mood-stabilizing medications. Depression and mania are two of the extreme emotional states connected to bipolar disorder. Medications known as mood stabilizers help you manage and calm your emotions, which reduces the frequency and intensity of mood swings. The optimal mood stabilizer for a particular individual will depend on their unique symptoms, medical history, and medication sensitivities. Mood stabilizers come in a number of forms. There are several drugs like this on the market. Lithium carbonate is a long-used mood stabilizer that is quite effective. It helps to lessen the likelihood and effects of both mania and depression. Many anticonvulsant medications, which were first developed to treat epilepsy, have also shown effectiveness in controlling mood. Anti-epileptic medications include Depakote, Tegretol, and Lamictal, to name a few. Some atypical antipsychotic medications work well as mood stabilizers as well. They work well for both mania and depression treatment. Examples are aripiprazole, Abilify, olanzapine, Zyprexa, quetiapine, Seroquel, and Risperdal. Although mood stabilizers may be quite effective in managing bipolar disorder, not everyone reacts to medication in the same way. Finding the ideal medication and dosage for each patient requires close collaboration with a medical professional. Regularly evaluating and altering the treatment plan may be necessary to optimize benefits while reducing hazards. 2. Antidepressants. Antidepressants are often used to treat bipolar depressive episodes. To reduce the risk that an antidepressant would precipitate a manic or hypomanic episode, antidepressants are often used with a mood stabilizer. People with bipolar disorder are often administered SSRIs, such as fluoxetine, Prozac, and sertraline, Zoloft, as antidepressants. The first line of protection against bipolar manic and depressive phases is mood stabilizers. The mood stabilizers lithium, valproate, Depakote, and lamotrigine, Lamictal, are some examples of those often suggested for bipolar disorder. Antipsychotic medications are often used in the treatment of bipolar disease, particularly for the control of mania. Symptoms including agitation, psychosis, and mental disorder may all be relieved by taking these drugs. Antipsychotic drugs, including aripiprazole, Abilify, and quetiapine, Seroquel, are an alternative treatment option for bipolar depression. A kind of antipsychotic medication, called an atypical antipsychotic, is often used to treat manic depressive episodes. They are helpful in treating manic or mixed-state episodes that are now occurring, and some of them could even help prevent future ones. Atypical antipsychotic medications include quetiapine, Seroquel, Risperidone, Risperdal, and olanzapine, Zyprexa. These medications may be used either on their own or with other mood stabilizers. When using antidepressants for bipolar disorder, caution must be taken to avoid the chance of triggering a manic or hypomanic episode. Antidepressants may be suggested, but only at the lowest effective dose, and the patient will be carefully watched for any indication that their mood has improved. After a depressed episode is gone, antidepressants should be discontinued, even if they were only used briefly, to prevent ongoing mood instability. Treatment must be individualized. While some individuals may only need one of these medications, others may require both mood stabilizers and antipsychotics. For monitoring results, managing with side effects, and making any course changes, it is crucial to have open lines of communication with a healthcare professional always. Although medication is a crucial component of treating bipolar disorder, psychotherapy and behavioral adjustments are often used with it. One kind of psychotherapy that has been shown to be successful in teaching bipolar patients how to manage their symptoms, identify their own personal triggers, and live well with the condition is cognitive behavioral therapy, CBT. Before relying on the information provided here to make any choices, please speak with a licensed medical professional. If you have any questions or concerns about your treatment for bipolar, it is advised that you speak with a qualified medical professional who can evaluate your particular situation and provide you guidance on the best course of action. Things to consider when taking bipolar medications. Bipolar disorder medications, like any other kind of medication, may have unintended side effects in certain individuals. Here we will look at the many possible side effects of bipolar drugs. Unpleasant digestive system side effects from several therapies for bipolar illness include nausea, vomiting, diarrhea, and stomach discomfort. Fortunately, these side effects often go away as the body becomes acclimated to the medication. Weight gain or loss may also be a side effect of bipolar medication. It is possible to have both metabolic changes and increased appetite, while other individuals may experience reduced hunger and weight loss. These changes may have a negative impact on the patient's feeling of well-being and confidence. Tiredness. Drugs for bipolar, particularly mood stabilizers and antipsychotics, might make you drowsy and exhausted. This might result in exhaustion, poor energy, and difficulty concentrating, all of which interfere with daily living and reduce productivity. Memory loss, confusion, and delayed thinking. These effects may have an adverse effect on quality of life, academic or professional performance, and cognitive abilities including attention, processing speed, and executive functioning. Potential sexual side effects include decreased libido, erectile dysfunction, and difficulty achieving or maintaining an erection. Effects of these drugs on health: hypertension, diabetes, abnormal cholesterol levels, and abdominal obesity has been related to several anti-manic and antidepressive medications. Given the elevated risk of diabetes and cardiovascular disease that comes with the use of these drugs, lifestyle adjustments and vigilant monitoring are recommended. Hormonal changes in the body are linked to mood stabilizers like lithium, which are often used to treat bipolar. Such anomalies may lead to thyroid dysfunction, which manifests as symptoms including fatigue, weight loss, and mood changes. Patients using such medications should frequently undergo thyroid tests. Antipsychotic drugs used to treat bipolar disorder can cause extrapyramidal symptoms such as tremors, muscle stiffness, and uncontrollable movements. These symptoms, which resemble those of Parkinson's disease, may significantly affect one's mobility and general quality of life. Neuroleptic malignant syndrome is a rare but possibly lethal side effect of antipsychotic medications. This condition's symptoms include elevated body temperature, decreased mental function, tight muscles, and autonomic dysfunction. The presence of these symptoms necessitates rapid medical attention. Tardive dyskinesia, a disease marked by repetitive, involuntary movements like tongue protrusion or grimacing of the face, and they may be brought on by long-term antipsychotic medication usage. This sickness could be difficult to treat, and even when the medication is discontinued, the symptoms might still be present. Bipolar medications, particularly antipsychotics, have the potential to have negative effects on cognition in certain individuals. Issues with executive functioning, memory, and attention are just a few of the possible negative effects. For many facets of daily life, cognitive impairment may have major repercussions. Antipsychotics have adverse effects such as increased heart rate, tachycardia, and low blood pressure, hypotension. You could feel weak and lightheaded as a result of these side effects, if not faint. Bipolar drug users should be closely monitored, particularly if they already have cardiac issues. Another possible side effect of medications used to treat bipolar is skin rashes. Rash intensity may range from mildly bothersome to seriously dangerous. A rash is a medical issue that has to be treated right away. Hepatotoxicity, a rare side effect of several bipolar medications, may be detrimental to the liver. To identify any liver problems, it's critical to routinely assess liver function. Some bipolar medication users may experience emotional blunting or a reduction in the strength of their emotions. It could be more difficult to completely appreciate life or engage in social relationships if you lack emotions. Antidepressants have been related to an increase in suicidal thoughts or conduct, particularly in young individuals. Close monitoring and continuous follow-up with medical specialists are needed to reduce this hazard. It is critical that patients and clinicians discuss these risks openly and honestly in order to make informed treatment decisions. Regular monitoring, collaboration with healthcare professionals, and open communication are the best ways to treat and manage these side effects and help patients achieve stability and a greater quality of life. Chapter 6. Therapy for Bipolar. 1. CBT. Cognitive behavioral therapy, CBT, has shown to be the most effective treatment choice for many persons dealing with mental illnesses, including bipolar disorder. By identifying and changing harmful thought and behavior patterns, cognitive behavioral therapy, CBT, may help people with mental health problems. CBT is often used in conjunction with medication to effectively treat bipolar. People with bipolar have been proven to benefit from cognitive behavioral therapy, CBT, in managing the symptoms of both mania and depression. Following are some potential benefits of cognitive behavioral therapy for bipolar disorder. Psychoeducation on bipolar illness is a component of CBT, and it educates patients about the condition's symptoms, diagnosis, and potential triggers for manic or depressed episodes. Patients are better able to actively participate in their rehabilitation when they are aware of their disease and available treatment alternatives. Mood monitoring. As part of CBT, Patients are taught to monitor their emotional state and watch for any signs of mood swings or episodes. People may avoid or treat their symptoms before they become worse by being aware of these warning signs. Behavior activation. CBT encourages patients to carry on participating in rewarding activities even while they are suffering depressive symptoms. People who suffer from depression may lessen their symptoms by organizing and taking part in activities that make them happy and give them a sense of accomplishment, as opposed to giving in to the need to isolate oneself. Participation of family and friends. CBT may include close friends and family in the healing process. They may participate in relapse prevention planning as a consequence, learn more about bipolar disorder, and hone their support and communication skills. Involving loved ones improves the person's capacity to cope and strengthens their network of support. Despite the fact that cognitive behavioral therapy, CBT, has demonstrated positive benefits in the treatment of bipolar disorder, it may not be a sufficient treatment on its own. To address the biological aspects of the condition, psychiatrists often recommend medication, such as mood stabilizers. It is often suggested that those who have bipolar disorder use a combination of medication and therapy. The ideal course of treatment for each individual patient may be determined with the assistance of a mental health professional, such as a psychiatrist or psychologist, who specializes in bipolar disorder and CBT. 2. DBT. Although dialectical behavior therapy, DBT, was first developed to treat borderline personality disorder, BPD, it has now undergone modifications to be used to treat a variety of mental health issues, including bipolar disorder. DBT is a kind of therapy that combines CBT methods with acceptance and mindfulness-based strategies. It seeks to help individuals live better in general by helping them learn how to manage their emotions, handle challenging circumstances, and build their relationships with others. That DBT may benefit those with bipolar illness in the following ways. Emotional balance. One of the things taught to DBT patients is how to recognize and manage their emotions. This could assist them in controlling their unpredictable conduct and managing the jarring mood changes brought on by bipolar disorder. DBT emphasizes on distress management techniques, which are crucial in emergency situations or when handling intense emotions. These skills might help people with bipolar disorder better handle stressful situations and control their destructive impulses. Effective communication may be challenging for people with bipolar disorder due to their mood fluctuations and other symptoms. Better communication and interpersonal relationships are fostered by DBT, which aids in conflict resolution and the development of deeper bonds with others. DBT employs mindfulness techniques to help individuals become more present in the moment. It has been shown that practicing mindfulness helps bipolar patients in a variety of ways, including greater awareness and control over mood fluctuations, less stress, and improved well-being. Dialectical behavior therapy, DBT, is often only one part of a more comprehensive treatment plan, despite the fact that it has proved effective in helping patients control the symptoms of bipolar disorder. It should be used with a variety of treatment options, such as support groups, psychoeducation, and medication. Self-management. In order to maintain stability, people with bipolar disease may need to closely monitor their symptoms, take their medicines as directed, and lead a healthy lifestyle. The ability to do all these entails self-management, and DBT may help people develop good self-management skills. Treatment participation and motivation. People with bipolar disorder may find it challenging to follow treatment regimens and keep up regular attendance at therapy sessions. The focus on acceptance and affirmation in DBT may help reduce treatment resistance and increase patients' motivation to participate actively in their own recovery. Support groups and family counseling. Family counseling and support groups may be very beneficial for those who have bipolar disorder, as well as their loved ones. It provides a safe setting where individuals may confide in one another and gain from the knowledge and inspiration of those who have gone through comparable situations. A kind of psychotherapy called family therapy involves treating a person with bipolar disorder with their loved ones. The goal is to improve family communication, educate the family about the condition, and come up with practical solutions for dealing with it. Family therapy may help with relationships, disputes, and the general mood of the family. A support network may help individuals connect with others who have gone through similar experiences, which can be a tremendous source of comfort and empathy. This fosters empathy and understanding and makes individuals feel like they belong in the group and are less alone. Family therapy and support groups may be excellent venues for discussing the difficulties of living with bipolar disorder and exchanging coping mechanisms. By sharing and discussing their personal experiences, participants may learn about productive treatments, self-care techniques, and local resources. Family therapy addresses how bipolar disease affects families as a whole. Family members gain understanding of how their actions affect the individual with bipolar disorder in a reciprocal manner. Through an examination of the interactions between individual and family members, therapy may improve family relationships. Stress reduction techniques. Stress often serves as a trigger or exacerbates pre-existing symptoms in persons with bipolar disorder. Here are some techniques that have been shown to reduce stress and improve well-being. Make a timetable for yourself that includes certain times for sleeping, eating, working out, and unwinding. Establishing a habit might help you stay calm and release stress. Deep breathing, progressive muscle relaxation, and mindfulness meditation are among relaxation techniques that may aid in your relaxation and general well-being. These techniques have been shown to be successful in reducing stress and anxiety. It has been shown that regular physical exercise, such as walking, running, swimming, or yoga, has a favorable impact on both mental and physical health. So learn to exercise. Excellent sleep hygiene may help you get the rest you need by helping you have a regular sleep schedule, create a relaxing pre-bedtime routine, and ensure you have a pleasant resting environment. Emotional stability has been demonstrated to be significantly impacted by getting enough good sleep. Reach out to those who can assist you at difficult times, whether they be family, friends, or individuals in a support group who are aware of your circumstance. Open conversation with others fosters a feeling of community and reduces stress. Also, by engaging in activities that bring you joy and relaxation, you can take care of yourself. Anything that makes you happy, such as a cherished hobby, a creative outlet, time in nature, self-compassion, or a relaxing bath and massage, may be considered self-care. Pay attention to the triggers that often send you into periods of stress or depression and take action to lessen their consequences. To maintain excellent health, eat a balanced diet. Abstain from caffeine and alcohol. Exercise and good eating habits. Adopting healthy behaviors like consistent exercise and a balanced diet may be advantageous for those who suffer from bipolar disorder. These behavioral adjustments cannot replace medical care, but they may enhance health and reduce certain symptoms. It is advised that you see your doctor or a mental health specialist before starting any new exercise routine. They can provide you guidance that is specific to your needs and assist you in exercising safely. Choose some enjoyable activities to engage in, such as walking, swimming, biking, dancing, or anything else that will get your body moving and your heart pounding. If you incorporate activities you like, you are more likely to stick with your fitness regimen. Maintain a weekly exercise schedule that includes 150 minutes of moderate exercise or at least 75 minutes of vigorous activity. If you break it up into numerous smaller sessions spaced out over the week, it could be easier to handle. Include strength training in your routine to improve your overall strength and muscular tone. For this, you may use weights, resistance bands, or even just your own body weight. Consider engaging in activities outside, since it has been shown that exposure to sunlight and natural elements enhances mood. Outdoor activities like hiking, gardening, or even simply taking a walk in a park is great. A balanced diet should include a variety of foods such as fruits, vegetables, complete grains, lean meats, and healthy fats. Limit your intake of processed foods, sugary snacks, and beverages. These have the capacity to reduce energy and disturb emotional balance. Make an effort to drink a sufficient amount of water each day. Being dehydrated has the unfavorable side effects of fatigue and an overall deterioration in health. Consume fatty fish, salmon, mackerel, and sardines, walnuts, flax seeds, chia seeds, and other nuts and seeds to add omega-3 fatty acids to your diet. Omega-3 fatty acids have mood-balancing effects. Patients with bipolar disorder must sleep adequately. Creating a regular sleep routine may enhance both your physical and emotional well-being. Aim for 7 to 9 unbroken hours of sleep each night. To get a good night's sleep, make your bedroom dark, quiet, and cool and limit any stimulating activities in the hours before bed. Chapter 7. More tips for managing bipolar disorder. While managing bipolar disorder at work may be challenging, it is possible with the right resources and a strong network of friends and family. Here are some recommendations for dealing with your bipolar disorder at work. Do a lot of research about bipolar disorder to get acquainted with the symptoms, underlying causes, and possible therapies. You can take better care of yourself if you are aware of the signs and causes of your illness. Build up a strong support system of coworkers to turn to when times are rough at work. Talk about your issue with a dependable colleague, your employer, or a human resources specialist if you feel safe doing so. They could promote a supportive environment and provide a helping hand when necessary. If you believe you may need to work from home, talk to your manager or employer about your bipolar condition. If it will help you cope with your challenges, they could be willing to let you work from home sometimes or lessen your workload. Establishing a regular routine may help with the treatment of bipolar disorder. Get adequate sleep, move around often, eat properly, and include stress reduction techniques into your regular routine. These practices may help you keep your body and mind in a stable condition. Taking care of oneself is crucial while managing bipolar disorder. To take care of oneself, meditate, take a few deep breaths, and engage in enjoyable and relaxing activities. Ensure that you frequently block out time for self-care. Workplace stress should be recognized and managed since it may lead to mood changes. Try splitting up large assignments into smaller ones. Set realistic deadlines for yourself, and be open and honest with your colleagues about how you're feeling if you're feeling overburdened. Additionally, if necessary, you should consider using stress management techniques like mindfulness or seeing a therapist. A primary focus should be finding a decent balance between work and personal life. Consider your physical and mental state before pushing yourself too far. Take frequent breaks, go on vacation when you can, and establish boundaries between your personal and professional lives in order to avoid burnout. Keep an eye on your symptoms by writing down your emotions, stresses, and warning flags. If you are aware of your inclinations and can see the warning signs of a mood change, you may be able to take precautions to avoid a full-blown episode. You may find it useful to use a mood monitoring app or a notepad to keep track of your symptoms. Find mental health professionals, such as therapists and psychiatrists, and schedule regular appointments with them. They might give you suggestions, help you develop coping skills, and alter your treatment plan as necessary. Meditation. Because mindfulness and meditation techniques should be used in combination with traditional medication and under the guidance of a qualified medical professional. Here are some techniques for mindfulness and meditation to try. Consider how each inhalation and exhalation makes you feel while you focus on your breathing. If your mind wanders, gently bring it back to your breathing. By using this method, you may be able to put your worries about the past and the future aside and begin to focus on the now. Mindfully go down your body, starting at the top of your head, pausing along the way to concentrate on any emotions or tension. This technique has the potential to improve both body awareness and serenity. Practice loving-kindness meditation to develop compassion and kindness for both yourself and other people. Send these feelings first to yourself, then to your loved ones, enemies, and even your buddies. It has been shown that using this technique would lead to more positive emotions and less self-critical thinking. Walking meditation, sometimes known as mindful walking, involves paying attentive attention to both your mental and exterior surroundings while you go from one place to another. Concentrate your attention on the feelings in your legs and the ground. When strong emotions arise, emotional awareness is resisting the urge to give in to them. Keep track of how you feel, both physically and mentally, and how that sensation changes over time. By taking a more impartial stance towards your emotions, you may improve your emotional resilience and reduce your propensity for reckless actions. Take your time and pay attention to what you're putting in your mouth. Consider the taste, texture, and scent of the dish. As you eat, take your time and savor each bite. This technique may help you have a healthier connection with food by teaching you how to recognize your body's signals of hunger and fullness. Remember that while using these techniques, you should be persistent and patient. Start with shorter sessions and then increase to longer ones to ease yourself into it. It's a good idea to seek out a teacher or therapist who can provide you guidance that takes into account your particular circumstances if you're just beginning your practice of meditation and mindfulness. Establish and maintain good relationships. Relationships may be challenging for those with bipolar disorder, but with persistence, empathy, and open lines of communication, they may create ties that last. Here are some potential strategies. Seek assistance. To maintain emotional stability and manage symptoms, schedule regular therapy sessions and take any prescribed drugs as instructed. The success of a relationship hinges on maintaining one's mental health. Spread the word. Tell your close friends and family how you really feel. More information regarding bipolar disorder, how it has impacted you, and what they can do to assist should be provided. Observe the signs. You may be able to see the early signs of mood swings or episodes if you become more self-aware. Inform your loved ones of these signs so they will be aware of when you may need their assistance. Set clear boundaries with your loved ones to ensure that your expectations and restrictions are respected. Talking to your spouse about your concerns and triggers is one method to do this. Reduce the harmful consequences of stress, unstable emotions, and mood swings by learning and using appropriate coping strategies. Exercise, mindfulness practice, journaling, or picking up a soothing pastime are a few options. Invite your loved ones to join you at therapy or support group meetings. This could provide them understanding of your circumstance and instruct them on how to help you most effectively. When things are calm, keep lines of communication open and honest. It's simpler to keep the channels of communication open when your mood is more stable. You may get closer and find solutions to difficulties more quickly by regularly sharing your wants, feelings, and ideas to your loved ones. Maintain healthy routines like getting adequate sleep, eating properly, exercising often, and adopting effective stress management techniques. The lifestyle adjustments you make may have a positive impact on both your mood and your relationships. Parenting and bipolar disorder. Despite the challenges you may encounter, having bipolar condition does not prevent you from being a loving and helpful parent. With the right support and resources, you can manage your bipolar disorder and your parenting obligations. Here are some ideas to think about. Seek medical help. It's critical to have a doctor that is knowledgeable about bipolar disorder and who is able to meet your unique needs. Work together to develop a treatment regimen that will enable you to satisfy your mental health needs and your obligations as a parent. Maintain a consistent schedule. Children thrive in a life that is somewhat predictable. It may be advantageous for both you and your child to stick to a schedule while handling stressful circumstances. Self-care is crucial while coping with bipolar disorder. Never lose sight of the fact that your success as a parent depends on putting your own health and happiness first. Make time for activities that might aid in stress management, such as exercise, therapy, hobbies, and social support. Depending on your child's age and cognitive level, you may gradually explain to them about your bipolar disorder. Using language appropriate for their age, describe the importance and probable emotional implications. Establish communication channels and provide accurate answers to their questions. Pay careful attention to your emotions and take control of them. If you notice any changes in your mood that could point to a manic or depressive episode, you should keep an eye on them and speak to your doctor. It's crucial to retain self-awareness and seek therapy as soon as you can in order to prevent more severe episodes that can interfere with your ability to be an effective parent.